is Dr. Ayub Kalathur. I'm a board-certified internal medicine physician working in the United States. This video is to give a brief idea about medicines used for treating diabetes so that diabetic patients and their family members are well informed. A better informed patient has better outcomes. Medications, of course, has to be prescribed by and supervised by a physician. In some countries, you can get some of these medications without prescription because of inadequate regulation. But I'm warning you, diabetic medications can be extremely dangerous if not used under the supervision of a doctor because of side effects, especially life-threatening low blood sugar attacks. Some of these medications also cannot be given in certain scenarios. For example, if patient has underlying kidney problem, hence the importance of a doctor to prescribe and monitor these. In short, this video is only for information purpose, and all these medications has to be prescribed and supervised by a physician. The side effects of medications I mentioned in this video are also only the main ones and hence are not all inclusive. Please go through the packet insert for a complete list of side effects of these medications or talk to your doctor. Let's begin. In type 2 diabetes, medications are tablets to begin with, unless blood sugars are dangerously high or if there is a suspicion of type 1 diabetes, when we have to start therapy with insulin from the get-go. First line medication with type 2 diabetes is a wonderful old medication called Metformin. Good kidney function is important to start Metformin because otherwise it can give you a very bad, sometimes even life-threatening side effect called lactic acidosis. The medication works mainly by decreasing glucose production by your liver. Other mechanism of actions are decreasing glucose absorption from intestines and increasing patients' insulin sensitivity or efficacy. Diarrhea is a common side effect. Sulfonylureas are another group of oral medications, main examples being glipizide, glimepiride. These work mainly by stimulating insulin secretion from pancreas. These have fallen out of favor because of potential for weight gain and dangerous low blood sugar attacks. The benefit being it is a generic medication hence is very cheap and hence still widely prescribed. Another group of oral medicines are Dpp-4 inhibitors like Januvia, Onglyza, Tradjenda. These work in multiple ways but mainly by stimulating insulin synthesis and secretion but do not cause as dangerous low blood sugar attacks as sulfonylureas. Pancreatitis or inflammation of pancreas is a dreaded side effect of this class. Pancreatitis is usually persons with upper abdominal pain kind of here radiating to your back. So if you have this when on this medication, you have to talk to your doctor right away. Another oral medication class is what we call glitazones. The drug in this class mainly is what we call Pioglitazone or Actos. These work by increasing insulin sensitivity or efficacy. These medications have slightly elevated bladder cancer risk, especially in current or past smokers. So not a good medication if smoking history or if there is history of bladder cancer. This medication is also not the best option for patients with congestive heart failure because of its predisposition for fluid retention, hence worsening the heart failure. Another class of diabetic oral medications are the new SGLT2 inhibitors like the Farxiga, Jardiance, Invokana, Steglatro. These work mainly by secreting blood sugar from bloodstream into urine by kidneys. Main side effect can be dehydration, slightly high risk of a diabetic complication called diabetic ketoacidosis, urinary infections because of high amount of sugar in the urine, and slightly high risk of amputations in patients with circulation problems. These are rare, okay? Don't get scared hearing this. The benefit of this class is mainly weight loss, and some of these medications are found to decrease strokes and heart attacks. So let's go through injections. There's a non-insulin injection treatment for diabetes called Glp Agonists. These are very popular and effective. The main attraction being it causes weight loss. It has also shown some decreased cardiovascular events like strokes and heart attacks when on these medications. Some of these are once a week medications and hence very easy to administer. It comes in pen forms. Examples are Victoza, which is daily, Trulicity, Ozempic, and Bydureon are once a week. This group of medication cannot be given in anybody with history of pancreatitis because pancreatitis is also a side effect of this class. This medication also cannot be given in somebody who has family members with something called MEN type 2 syndrome or MEN type 2 syndrome. Part of this syndrome is a rare thyroid cancer called medullary thyroid cancer, and if there's a history of such cancer in the patient or family, this class of medication is not to be given. So if none of these medications are working or not working enough to control diabetes, then insulin therapy is started. Other scenarios for earlier insulin are, for example, poor kidney function where some oral medications cannot be given, or if there are side effects or scenarios where some oral medication class can be started, or if blood sugars are dangerously high to begin with. When starting insulin, some oral medications dose is decreased and some are even stopped. In type 2 diabetes, insulin therapy is usually started with something called a basal insulin. Basal insulin is a long-acting insulin, meaning it works close to 24 hours or even more, and hence usually dosed once daily and usually at bedtime. They can cause low blood sugar attacks but lesser because of the 24-hour slow action. All basal insulins are injections. They come in pen forms and the needles are the size of your eyelash and hence very small and not at all painful to administer. They are to be injected underneath the skin of usually of your stomach or your thighs. It is important to rotate the injection site, meaning inject at different locations on the following days for better efficacy. Basal insulin mostly addresses before meal blood sugars. Some of these insulins are Lantus, Basaglar, Toujeo, Tresiba. When after meal sugars are going significantly high and fasting or before meals are controlled, that means basal insulin is not enough and oral medications and basal insulin is not working enough. This is the point when we add short-acting insulin or mealtime insulin. Examples of these insulins are Humalog, Novolog, Lispro, Epidra. These insulins can cause dangerous blood sugar attacks and hence any dose adjustments or new starts should be under close supervision of a doctor or a clinical pharmacist. The short-acting insulin is administered just prior to meals, which is hence usually 3 times daily if you're eating 3 times a day, meaning it is very important to eat within minutes after these insulin administration to prevent low blood sugar attacks. We call this regimen of a basal and bolus insulin as a basal bolus regimen. Basal insulin is the Lantus, for example, and bolus, for example, is the Novolog. When on basal bolus regimen, usually all other diabetic medications are stopped. Another way of managing diabetes is through insulin pump. Insulin pump is a small device which patients wear, which only uses short-acting insulin. The pump constantly injects a small dose of insulin throughout the day to cover for the basal insulin, for example, the Lantus, and the patient activates the pump to give extra dose of insulin, which mimics the bolus dose or short-acting insulin prior to meals. There's also a new class of insulin called inhaled insulin. It's called Afrezza. These are equivalent to short-acting insulin. It comes in pre-filled cartridges from which the insulin is inhaled, like you suck it into your lungs. It's still not very popular because it cannot be given in patients with lung diseases, and lung function has to be monitored by pulmonary function testing every year to ensure lungs are not getting affected by this inhaled insulin. So it's a little tedious to manage it. With that, I'm concluding the medication part. One last thing to mention, a patient who has a morbid obesity, which is BMI 35 or above in a type 2 diabetic, and cannot lose weight, you could sometimes cure type 2 diabetes by a procedure called bariatric surgery, which is a gastric bypass or gastric sleeve surgery. The reason being, once these patients lose a significant amount of weight, insulin resistance goes down. They also can eat large portions after the procedure. So insurances usually approve this procedure for a diabetic with BMI about 35. Of course, this procedure is not for everybody, but worth talking to your doctor to see whether it is an option for you. So with this, I'm concluding this video. Hopefully this video was very informational. This video is, like I said, is mainly for patients who are on medications and are supervised by a doctor or a physician. So take care. Bye.